There are many different reasons for needing a feeding tube, but the common goal is to obtain nutrition. There are two basic types of feeding tubes. One feeding tube goes into the stomach. The other feeding tube goes into the small intestine. For this video, I will focus on the feeding tube, which goes into the small intestine. Join me this week as I talk about nasojejunal feeding tubes. A nasojejunal, or NJ tube, is a soft, flexible tube which travels through the nose and stomach and ends in the area of the small intestine called the jejunum. Most of the time, an NJ tube is only used for 4 to 6 weeks. If a feeding tube is needed for a longer period of time, a more permanent tube called a J tube may be used. A nasojejunal tube may be needed if a person cannot tolerate food in his stomach. This problem may arise due to having severe reflux or vomiting, having difficulty absorbing food, having problems in the gastrointestinal tract, or the stomach does not empty fast enough. A nasojejunal tube is put in place at the hospital. It is done either in the medical imaging department or at the bedside. The NJ tube is usually placed while the patient is awake. The placement of the NJ tube involves these general steps. The patient will be positioned with the head elevated or in an upright seated position. In some cases, a topical anesthetic may be used to reduce pain or gagging. The appropriate length of tube is estimated based on age and body measurements. The tip of the feeding tube will be lubricated to allow it to pass more easily through the nose. The patient will be told to look down and tuck his chin to his chest. A nurse or other care team member will insert the tube into one nostril. The tube will then be moved slowly through the nasal passage. The patient will be asked to swallow water. This helps the tube advance down the esophagus and into the stomach. Once the NJ tube has reached the stomach, a syringe may be attached to the tube and a stethoscope may be placed in the stomach. While listening to the stomach, air may be pushed through the syringe. If the nurse hears the air in the stomach via the stethoscope, this confirms the tube is now in the stomach. When the tube has reached the stomach, the patient will need to wait about 30 to 60 minutes for the body to advance the tube into the small intestine. The tube will be secured to the face with medical tape to hold it in place. When it is believed the NJ tube has advanced into the small intestine, X-ray is used to make sure the NJ tube is now in the jejunum. Once the correct placement of the NJ tube has been confirmed, the tube can then be used. When we eat food by mouth, the food is delivered to the stomach. Once the food reaches the stomach acid and enzymes begin to chemically digest the material. The food is also moved back and forth, which helps break it down into smaller particles. The food is turned into an acidic liquid called chyme. The chyme is gradually released into the small intestine. The small intestine then slowly moves the food through the long gastrointestinal tract. One thing to note, the stomach acts as a reservoir. This means we can eat a large quantity of food during a short period of time. The food remains in the stomach until it has time to be broken down by chemical and mechanical digestion before it is released into the small intestine. A nasojejunal tube delivers nutrition to the small intestine. Unlike the stomach, the small intestine does not have the ability to break down solid food into liquid. Thus, the nutrition used in NJ tubes needs to be a liquid. The liquid used is often referred to as formula. Since the small intestine has a limited ability to digest food, the most commonly used formulas with NJ tubes are made from partially or completely digested molecules. Also, the small intestine does not have the ability to store food. This means the formula will need to be given at a slow rate over a long period of time. A feeding tube pump will be needed. This allows formula to be infused at a constant rate. It will take time for the body to adjust to using a feeding tube. The feeding tube pump will be trialed at a slow speed. If the patient can handle it, the speed will gradually be increased. It may take a few days to a few weeks to tolerate running the feeding tube pump at full speed. Please note, some people cannot tolerate having the feeding tube run at a fast rate. If this is the case, do not be discouraged. Talk to your medical provider to find ways to work around this. When the feeding tube is first used, the abdomen will most likely start cramping. This will go away as the body gets used to having food delivered directly to the small intestine. As the formula is infused into the small intestine, the sensation of being hungry will go away. When the feeding tube is stopped, hunger may or may not return depending on how much of a person's nutrition is being given via the feeding tube. If the feeding tube is providing supplemental nutrition, then hunger will most likely return when the feeding tube is turned off. If the feeding tube is delivering 100% of the person's nutritional intake, then the person will most likely not become hungry when the feeding tube is turned off. When I've had feeding tubes, my stomach has never hurt. The feeding tube passes through the stomach and has not caused any issues. Nasojejunal tubes are usually used for less than 6 weeks. If a feeding tube will be needed for a longer duration, please talk to your healthcare provider about getting a different tube, such as a J tube. Prolonged use of an NJ tube may injure the nasal cavity and sinuses. It is also recommended that the NJ tube be changed from one nostril to the other every 7 to 14 days. This will help reduce skin irritation. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Happy Memorial Day. Bye-bye.